Okay, thank you all for attending, and very much thanks to the speakers. This is the next in a series of COVID-19 specific webinars that BCI is sponsoring. This was on credentialing and contact tracing. And I think that it is one of the most complex computer security issues we have at this point. I mean, the last webinar we got to hear about election security, which is also a very complicated field, as there's lots of conflicting models that are trying to get to work, lots of conflicting goals. But I think one of the amazing things about this digital contact tracing is that not only do we have those conflicting goals, we also have an undefined and still fluid dynamic of what we actually want to have happen. We know from COVID-19 that I think we've all heard about contact tracing, and that it can be vital to helping trace and prevent the spread of the virus. And as a information security age, we say we can take this on, we can use technology to help us solve this challenge. And I think that is wonderful, and I think the first step to taking on these huge complex issues that can be very controversial is starting the conversation. And so I really am looking forward to the talk, and I welcome all of our speakers who have taken on that challenge and said, I think we can help in this area and take a shot at addressing some of the concerns. And so again, welcome and thanks to our speakers. And with that, I'll turn it over to Debbie, and she'll be moderating and kicking us off.
Great, thank you very much, Diana. I'd like to say that one of the reasons I'm here is because I was one of Becky's friends and colleagues in trying to make security work better, which is one of the impetuses behind the Base Cybersecurity Institute. And so I'm pleased to be able to contribute as it grows its webinar series and gets the reputation that it will deserve. Today we're talking about, oh, I need to share my screen, excuse me. Yes. Today we're talking about digital credentialing and contact tracing while preserving privacy. And my fellow panelists are Arka Bala from Context Grid, yes, Aman Johar from Proteum and Voten, and Denzel Wessels from Primary Care to You. At this point, I'd like to ask each one of them to just spend a minute saying why you're here and just a little bit about your background for the audience. And we'll start with Arka.
Hey guys, great to be here. My name is Arka Bala, and I'm actually the founder of a company called Context Grid, where we're focusing on creating a thing called the spatial web. We'll probably get into that a little bit later, what spatial web is, but the spatial web can enable a lot of tracking and location technology, which can be used to alleviate some of the issues that we see with COVID-19. And that's one of the reasons why I was involved in forming Health Grid Alliance, where I'm acting as the CTO and, you know, just looking at the general technology and what needs to happen on the technical side. And that's me. Thanks.
Great. Aman?
Hello, everybody. Thank you for being here. Aman Johar from Proteum Capital. I'm the co-founder and principal there. And we are generally involved in creating ecosystems, working with large and small companies, both to bring innovative technology to markets and with a particular emphasis on blockchain technology as well. And the three areas for my interest happen to be connected devices, fintech applications, and media and entertainment. And while doing all of this, got connected to a really amazing company called Voten that we invested in as well last year. And as the COVID situation was unraveling, we found a great use case in, you know, just pivoting the solution that we were already building in the credential space for tackling this global pandemic. So happy to be here and talking about it.
Great, thank you. And finally, Denzel.
Good day, everyone. My name is Denzel Wessels. I'm CEO of a stealth healthcare startup. My background, comes from cloud security, providing, security and network solutions, and really focusing on zero trust for the last, 15 years. And it's, really driving how we protect data, protect people, honor HIPAA, those types of things. And, I joined today to, as we go through this discussion, to kind of dig a little deeper into privacy with the group.
Great. So the way this is going to work is that I'm going to spend a few minutes talking about context tracing in general, so we all have a similar vocabulary and setting for the rest of the discussion. And that will lead into Aman talking about digital credentialing. A word for that you might also be familiar with is the idea of a, quote, immunity passport, unquote. And then Arko will talk about how the spatial web and the spatial technologies that he mentioned in his introduction have a place in contact tracing and also in other kinds of applications that might help deal with the spread of COVID and getting back to normal life. At that point, we'll ask Denzel to ask us questions, and he's prepared the questions ahead of time. We do know what they are, although we have not really prepared structured answers. And there are 4 key questions that we think you're going to want to know the answers to. We'll spend a few minutes talking about each one of those questions. And at that point, we'll also start engaging with the audience. And we've left an additional 10 to 15 minutes at the end to try to have more of an open discussion about questions that are raised by the audience, because we know this is a topic of great interest to everybody. So at this point, I'm going to go ahead and talk a little bit about contact tracing. So I'm sure by now that you all know what contact tracing is. It's a technique for containing the spread of a disease. And the picture on the left is intended to just remind us all about how diseases spread. They spread because you have contact with other people. Now, during shelter in place, we don't have much contact with other people. But as people get out and about, the number of contacts that a person has in a day is something like 30 to 40. And maybe 10% of those are sustained enough that it would be possible to spread a disease. So you can see the way that things multiply. This picture, by the way, was intended to show R0, which is not the point that I'm using it for. So please don't point that out to me. I'm already aware of that part of it. So what does contact tracing do? Well, when somebody gets diagnosed as being positive for COVID, an investigator asks them about their contacts and then reaches out to those contacts, again, the 3 or 4 that seem like they might actually have been susceptible to infection, and asks them more about the contact, may ask them to isolate, may ask them to get tested themselves, and then ask them about who else they've been in touch with. So it's a problem that can grow quite quickly. The goal is to contain the spread of infection. And in fact, this stage is referred to by epidemiologists as containment, as opposed to what we're doing now with the masks and so on, which is really more about what they refer to as mitigation, just to get the vocabulary clear. So, yeah. There we go. You may or may not know that contact tracing is a pretty manual process. So the big box on the left is just a list of the documents that the CDC has put forth to help contact tracing organizations. And as you can see, it's all about interviewing and collecting data and assessment and checklists. You can see there are scripts that they've prepared that some states are using. And this is a problem that every state in the country and most countries around the world are dealing with. And yet, you can see from the pictures, even from the CDC, you see somebody sitting in front of a computer on the phone. And what they are using the phone for is to simply start this conversation, or using manual checklists. Now, obviously, digital technology can help. Contact tracing has a scaling problem. It can be pretty ineffective because it depends upon people's memories. And it assumes that you know who you've been in contact with. So obviously, if you're out and about walking in downtown San Francisco, and then you stop at a newsstand and there are people waiting in line with you, you're not going to know who those people are under any circumstances. And it can be pretty inefficient as the number of contacts grows. With tracing, we have internet scale, we have digital audit trails of various kinds, and it's being collected by phones, devices that we're carrying with us all the time, so that it can minimize the amount of human effort involved. So the ideal solution is that you combine them. And of course, that's not going to be perfect. No solution is going to be perfect, and some of what we'll get into are some of the trade-offs involved in trying to use each one of these approaches to their advantage. Now, there's a lot of people involved in this. I don't want to spend too much time on this except to point out that the groups in orange are primarily technology facing, and the groups in blue are primarily human being facing. And you can see that there's a fair amount of overlap and quite a bit of different communities whose points of view need to be understood and respected if we're going to make these kinds of solutions work. Now, I'm the executive co-director of a group called the Health Grid Alliance, and we are trying to build that kind of community and alliance. And you can see that both Context Grid and Voten, who are represented by two of my other panelists, are already on this chart because we're all trying to work together. Now, a big question is, will contact tracing apps really work? And I thought I was going to show you a bunch of examples, and it turns out it's happening so quickly and changing so quickly that rather than try to do that, I thought I would just show headlines from the last 24 hours and also the results of a poll that say that Americans in particular, and we live in an opt-in world, aren't completely sold. So the big pink part of that are people who think that location tracking for COVID apps is not going to help very much. And there's other polls that show that they don't really trust sources of applications for this purpose, like Apple and Google, big tech companies. They don't really trust the government. They kind of trust the CDC and the public health authorities. So there are some pretty serious, some pretty serious challenges. And I'm going to turn the discussion over now to Aman. Just reminding you again, he's going to start in by talking about things related to immunity passports, one of the big topics in this field at this point. Aman, take it away.
You're on mute, Aman.
Yeah.
Oh, there you go.
Sorry, yeah. So thank you, Debbie. That was a pretty good primer for what we are trying to do here and a good introduction to what I've been involved in. So as I said previously, one of the companies that we invested in early last year is a company called Voten. And as the global pandemic started to unfold, we were looking at how do we start to revive the economy back. Even by early April, there were millions of people whose liveliness had been impacted. And it is imperative that people start to go back to work and start to be productive in the society. And with that in mind, we started to formulate a strategy of how this thing is going to work. So as we were thinking through the issues, and Debbie highlighted a couple of them, one on the travel side, and then Norway being skeptical about privacy concerns, I think those were paramount in our minds as well as we were designing a solution around this. And let me also say that we're not in this doing it only by ourselves, but we are now collaborating with the likes of Oracle and Intel, we utilize Oracle's blockchain solution platform to host the solution and provide for all the basic infrastructure. We are also collaborating with the Health Grid Alliance to bring in the contact tracing functionality of part of it. And very interestingly, a lot of the demand that we are seeing coming in has been from live events, which have completely been shut down. So you can think of sports leagues, you can think of live concerts, things like that. And they really are struggling to find a solution where people, not only their own employees at the football or soccer or the basketball leagues to come back into work, but also to provide fan experiences. And one of the collaborators there is the Innovation Institute for Fan Experience, and Lou Marciani practically wrote the handbook for operating public venues safely. So I'll talk a little bit about that as well. So in order to really answer the question, how do we get back to normal life? I think safety is a really important characteristic of that. And I think in the post-pandemic world, one of the things that has been lost is the trust element on public safety. Because as we all know, everybody is so protective about their personal data and their personal health records that it is almost impossible to verify whether somebody might be pre-symptomatic, asymptomatic, or even exhibiting symptoms and not sharing that information in a public setting. So the question is, how do we really verify that a location or a place is not a hotspot and there are not people who should actually be taking care of their health, and they're not just roaming around and spreading the virus. And like Debbie said previously, the R0 is pretty high, so you really want to box in the virus. Now, when you start to think about verification, it really needs to be transparent. It needs to be respecting privacy of people, and there should be a way of independently verifying that information as well. And if you go back through the chain, it needs to, again, interact with the testing facilities, the healthcare side of it. You can bring in all sorts of technology, but unless you bring in the healthcare element, it is almost impossible to guarantee that people are not exhibiting the symptoms and they should be free to be going anywhere. I know these are very interesting times we are living in, and there's no precedence for it, but I think we should be looking at it as a solution that really is trying to be helpful for everybody else in the society as well. And we can talk a lot more about it. So what we came up with was a solution that really says that we can issue healthcare credentials by talking to the healthcare guys. People go in, they get tested, whether it is the antibody test or the PCR tests, or there's a new antigen test as well available now. And based on those test results, all we need is information about the person themselves, the identity of the person, and the test result, right? Now, this illustration does show a lot of personal information, but it is up to the implementation on how much information you want to show. In an ideal scenario that I would recommend to everybody, this should be as easy as a boarding pass when you're taking your flights, right? There's only a simple QR code, and you scan it and it gets verified in real time and independently, and you either get a red or a green signal, right? But in this scenario, there's also a case where, well, if you are infected, it's pretty simple. You need to be taking care of yourself, and if you're not if you're not carrying the virus, that's simple too. But in the middle are a lot of people who may be exhibiting some symptoms, not all, or they are involved in healthcare facilities or manufacturing units or employment scenarios where you really need to take into account the policies of that particular unit. And we are able to bring those into action here as well, integrated with the policy on how these certificates need to be issued, and make it make those certificates valid for a short period of time or conditional on certain other rules and policies that the venues might have. And like I said, this is the biggest push we are seeing is coming in from, and the demand is coming from live venues. And I'm taking the example of Avaya Stadium. It's in my neighborhood. So what really happens is when people need to go to Avaya Stadium, right, whether it is their own employees who are responsible for the operations, the security, the management of the stadium itself, or however, all they need to do is take a home test, either through a home test kit, or the stadium can actually provide a point of care kiosk. And from there, we can integrate into the test results of that test being taken by the users. And if the test is all negative, that's perfect, because we don't need to share a lot. We don't even need to store or share a lot of information for a negative test. All it needs to be done is a blockchain-based credential that is issued to the person, and they can take it to the Avaya Stadium, scan it on their regular gun readers, and be allowed access into it. But the more interesting part is what happens when somebody tests positive for the virus. Now, this is exactly where the contact tracing needs to come in. And this is where I'll let Arka talk a lot more about how they're using the Google and Apple APIs in integrating with us.
Excellent.
And one of the things that I would just mention that from a solution perspective, we comply with HIPAA laws, we comply with privacy laws, we comply with the W3C information exchange standards. And the solution is pretty easy to use without any training required on part of those administering the tests or integrating with our kits here. And if you're interested, I'm happy to go through a demo separately outside of this, and we can talk more about this. So I'll let Arka talk more about the contact tracing side of it, and then we can come back and talk more about the solution.
Go ahead, Arka.
Yep, thanks, Owen. Okay, I'm going to share my screen. Second. Okay, hopefully you guys can see that. So I just want to start with introducing ContextGrid. In the beginning, I said ContextGrid is working on a thing called the spatial web. And basically what it is the spatial web is internet, but you'll experience that in the physical world around you. So instead of experiencing the internet on a 2D screen, you'll be walking around perhaps with an augmented reality device, such as your phone, and you'll be able to experience different kind of information. It could be in the form of a hologram, or it could be an audio prompt, as you see on the right here. And but there's a slight problem with currently. There's tons of contextual data that could enable the spatial web. An example of that could be the testing device, or even people that Aman just described. So people have contextual data about them. For example, contextual data could be what's the status of their COVID test. It could be also a testing device and where it's located. So there's tons of contextual data that's out there, but there's no one place to be able to find this type of data. So we're creating a sort of index is required to be able to have this in one place and discoverable. And also there's no universal way of looking up this data too. And also there's multiple technologies that go behind reading this type of data, which I'll also explain in the next slide. So this is ContextGrid. What we're working on is a global registry of all contextual data. So potentially you could store results from tests, you could store information about people in this registry, and also about any object in the world as well. And we also have a spatial browser which is able to browse this data. And this is some of the way we integrate the spatial web. We were able to read location data from services like Wi-Fi's or Bluetooth beacons, or some of the advanced location services like 5G has location capabilities where using 5G node triangulation, you'll be able to figure out where exactly a phone or a mobile device is. And then we integrate a lot of other protocols as well to be able to enable this, and standards that's been set in the spatial web world. This is some of the apps that HealthGrid Alliance has built using some of this spatial technology that was developed by ContextGrid. They're actually working software, which I'll show you a quick demo of as well, which consists of a bunch of contact tracing apps. It's also able to show some data about what's happening around you, around COVID-related hotspots. And you can obviously, there's a lot of privacy implications of this too. Which is the next slide. So all the contact tracing apps that's being built using ContextGrid technology and in partnership with HealthGrid, all the tracking and location data stays on device. So nothing actually goes to a centralized server ever. Also to note, user controls all the data that's being shared. So if you don't want to share anything, you can prevent it. And no PII data is collected in the current apps, the contact tracing apps. One more thing to note is also all the matching algorithms also run on the device. None of that happens on the server, which also protects privacy. And only in the case of when users test positive for COVID-19, then some of these logs are anonymized and sent to a central distribution server, which distributes the Bluetooth IDs or some of the anonymized location IDs to normal users. And finally, we also are able to anonymize the hotspot data and expose it to people like organizations like CDC or other public health authorities, so they can better manage the pandemic. This is a video of some of the apps. I'll play that now. Hopefully you can. So the first app I want to show you is an app that was developed using the Apple Google APIs. As you can see here, the app we've created is called Your Exposure. So if I fire that up, I go to a screen where it says that it's been developed in conjunction with Apple and Google. And what's going to happen is you're going to have a contact tracing app like this, and during the day, every day, it'll automatically check whether you've come into contact with any patients who have reported to be COVID-19 in the past 14 days. So I can also click a button called the Check Exposure button here, and this will connect to our backend services which is being developed in using some context-based technologies around registries and managing the data, and figure out, like, get a list of IDs which have tested positive, and then you can compare that on the phone to say whether you were exposed to someone or not. So if I go and check exposure, it says, okay, it looks like I have come across somebody. This is obviously mocked up beta right now, but it's actually working code. So, and then I can figure out, try to see like when these kind of exposures happened. I can click this, and it looks like some of the possible exposure lists are here. Cool. That was the demo. I'll turn it over to Debbie after this. You might be on mute, Debbie.
Sorry. Yes, thank you very much. And at this point, we're going to go into the question and answer period, but we're going to start by having Denzel, our esteemed respondent, pose the biggest questions. I do see that there are questions from the audience that are coming in, and I will try to interleave them as possible. We also, again, are leaving time at the very end for people to be able to answer, get some of your questions answered. So keep those cards and letters coming in. And this is Denzel's floor. So Denzel.
Good. Thanks, Debbie. So look, guys, I'd like to dig into a few of the more contentious questions that are out there, because I think they're the important ones. If we can talk about these for a little bit, I think it can, start getting a lot of comfort with technologies being built that are coming. And I think the first one is, where does data like this need to be stored for solutions like this to work? And, kind of a second part to it is, what steps do you go through to actually protect that data?
Okay. So maybe I can start first on the credential side. So the kind of data that we really store for issuing a credential is, you've got to look at it in a couple of different ways, depending on how deep of an integration you want to do with the healthcare side of it. Do you want to just integrate in directly into the likes of Epic and other EMR systems which have a lot of data? I don't recommend that, because this is a very specific implementation of the technology, and all I'm interested is in what is the test result, and that data is enough for me. Now I need to marry that data with the identity of the person so that it's tied in some way to my identity or my cell phone, and I'm carrying that digital credential, right? So one of the good things we do is we separate the data that we collect in two different chunks, and they cannot be recreated in an external environment. And you cannot look at my credential and get back to me. And that is because there's a layer of blockchain in between, which essentially contains the hashed version of my identity, my test, and again, depending on the implementation, how much of that data I need to put in the blockchain. So we recommend the minimum part of it, which is what kind of tests did you take? Were those tests reliable and were administered at a reliable facility? When did the certificate, when was this certificate issued to you? And when does it expire? Because that's like the holy grail of making this work, is if you have open-ended certificates, they never work. So there are trigger points when those certificates automatically expire. And that's about the information that we store on the blockchain. On the off-chain data, that's where it's just a regular database, encrypted, of course, and that's where we store most of the PII information. And whenever the certificate is issued, that PII gets encrypted, then gets hashed before it ends up in a blockchain environment.
Great, thank you. And Orca, would you like to talk a little bit about that with respect to contact tracing?
Absolutely. So in case of contact tracing, the first thing we wanted to do is make sure we do everything we can on the phone itself. Because if it leaves the phone, it's a whole different story. People will get scared about privacy. So what happens is your location logs for the last 14 days is stored on the device only in the form of encrypted JSON, which lives on the phone's file system, never leaves the file system. And what's in it is usually would be Bluetooth IDs of the phones you've seen or been close to, or potentially location of your own, GPS location, or a combination of some other location services that you would store on device. And every 14 days, anything over 14 days gets deleted, because it doesn't make sense for a contact tracing process to think of history beyond 14 days. And also we geofence all the location being recorded around your home, or you can even specify certain locations that you don't want any location to be collected. So there's a bunch of things we have so that we make sure that there's no ways for any government authority in the US or abroad which are able to track you back to find out who you are. And also, I think I already mentioned that we do not collect any PII data as part of the registration. It's all without any email address or your own personal details. It's just an install of an app, and we can do everything based on that.
Great.
Okay, cool. Thanks, Orca. That kind of leads to a follow-on question. If you look historically, being on the list has had very negative connotations, right? It's led to things like privacy violations, human rights issues,
Yep.
All the way to physical harm for people.
Yep.
How do you address that concern?
So Can you repeat the question one more time?
Yeah, so it's, you know, if you really look at what we're doing, is we're creating a list in essence of people that have COVID and people that do not have COVID, you know, and
Yes.
there's contextual information around it. And I think there's a lot of fear of being on a list because we've seen it historically go wrong. And I think, you know, looking at history is a great way for us to make the future a better place. So if you know, what would you say to people that have that fear of being on a list?
Right. So first of all, there is no central list of all healthy users. We have no idea who's healthy because you know, we're not recording any of that information. The only time we have a list is when we have someone testing positive for COVID-19. And at that point, you're already known to a public health authority who would have done the test. So, you know, you being on a list or a central distribution server list, which is being sent out, again, anonymized, it doesn't add any extra risks to you in a way, if that answers the question. But yeah, absolutely. That data is very should be protected to, you know, at all costs, because you never know. Like if your neighbor finds out that you gave him COVID-19, you wouldn't be very happy about that, right? And you never know how people react these days. So you're absolutely right. That's the data that's very sensitive, but it's up to the public health authorities to manage that data, and not up to us really, because that data is actually coming from them.
Okay, thank you. Iman, kind of maybe a second part to that from your perspective. You know, you're creating credentials using blockchain. What are the risk of people that, let's say, have contracted COVID or have been exposed to it, creating their own fake credentials? You know, their own fake QR codes. How are you protecting against that? Again, you know, people will do anything to get off of a list too. So I think there's the counter side of that too.
Yeah, and that's an excellent question, because that's come up with every sports league that we've talked to, because, you know, there's millions of dollars riding on every player, and there's a perverse incentive to creating these fake QR credentials and trying to game the system as well, right? So I think one way to think about it is, well, we are doing these credentials, but then they are also tied into the policies of the venues. And one distinction that I should make right up front here is that we are not creating a completely SaaS kind of an environment where anybody can come in and start issuing certificates and all of that. But this is planned organization by organization, and so that we can include the rules and policies that their health care people are telling them to include for very specific situations, right? And unless people go through those tests in addition to the COVID testing itself, they're never issued the credential. And then those credentials also expire. So yes, if you're holding on to an older credential, then it may not work. The next time you come into the facility, it may not work because it's expired. And one good example of that is, and this is where the Health Credential Alliance is very important as well, is because let's say I got a credential, I tested this morning, right? And I got a clean green signal to go out and live my life normally. And in the afternoon, I go to Mountain View for lunch and I get contracted there, right? Now, if there's a contact tracing app that can tell me that, you know, Mountain View was a hotspot, why did you go there, right? That credential that I got in the morning, that can automatically be revoked, right? So the next time I come in, yes, anybody can spoof my QR, but it's not going to work anymore because that QR was in a location where it should not have been.
Awesome, thank you. You know, the next question I was going to go into was, you know, around, you know, what PII is collected or metadata around it. Arca, especially, I think from your standpoint, when you're running around and you're collecting all this location data, you know, Wi-Fi hotspots around you, Bluetooth information,
yep.
You know, what's stored, and how is it anonymized or protected? I think you touched on that a little bit, talking about, you know, what Apple and Google are exposing, but maybe you can go into that a little bit more.
Sure. So in Apple and Google's case, you are looking out for a beacon ID or a UUID, potentially in this case. We haven't exactly seen what the ID is, but it's a unique ID that your phone, which is acting as a Bluetooth beacon and transmitting, constantly transmitting what it is. And you, as another user, you might be walking past it, and depending on how close you are, it'll either read it and store it, right? That Bluetooth ID rotates every, I believe, either 5 or 15 minutes. So it's randomized, even, and this is handled by Apple and Google. Apple and Google are super sensitive about privacy. So actually, most governments are trying to sort of butt heads with them to figure out, like, you know, if there's a middle ground or not where some of the location data can be stored. But in Apple and Google's case, it's just a randomized Bluetooth ID. So there's, because your phone holds the key to randomizing it, there's no ways for a government agency to reverse engineer and figure out who you are. So that's the Apple Google API-based contact tracing app. In the location-based contact tracing app, we're just storing the GPS location without any sort of ID or device ID or your, you know, who you are along with that. So, and only that, the data never leaves the phone for healthy users. Only in the case of when you test positive, you can control who can, you know, if you want to share that data or not to help others and to contact trace. In that case, none of the only thing that's sent over is the test ID from a public health authority, along with your location logs for only for 14 days for the COVID positive user. And obviously, once it's in the central distribution server, once it's been dissipated, we also delete that data. So we don't want to keep that data. Some of that data might be taken by again, anonymized and shown in dashboards to CDC to be able to show where the matches are happening. Now, just like Aman said, if somebody, you know, the contact tracing apps were able to show some of these anonymized hotspot data to you and say, by the way, there's a mall which is close to you and you were thinking of going, but there's 20 matches that happened the last week. You might think twice about going there. And, you know, again, building on Aman's case, Voten might say, if you did go to that mall, your credential might not be as valid, or it might expire in some fashion. So there's a lot of ways of doing it. For sure, we haven't figured out exactly all of it, but privacy and PII is top of our concern, and the way we're building it, it will be HIPAA compliant and everything else as well, the way we're handling the data.
Mon, anything around the credentials, the credentialing side that's worth sharing from your standpoint?
Well, I'm looking at a few questions here as well. Maybe I can talk to some of those. Well, like I said, the expiration of credentials is an important part, but then it needs to be married into what the policies are. So far, I think what we've been looking at are solutions that employers can use, and these are large employers, by the way, right? I mean, you have 20-30,000 people working for you all across the country, and you need at least a portion of those critical workers to be coming to your offices. What kind of policies does your HR put in to allow people to come in, scan? Everybody scans their badges, but is there something else that needs to be added to that? So we work in conjunction with those systems, right? And it's kind of incremental, and the revocation of those policies is based on what the employer policies are. And the other part of it is also, if you're going to be working for any company out there, you're kind of consenting to abide by their policy. So there is that implicit opt-in, so to say, to be able to share your information, the use of the credential that's been created for you.
Okay, excellent. Look, I think you know, the last question I had for you two was, you know, about the exposure risk for individuals. You know, if these solutions are compromised, and you know, kind of the steps you're taking to prevent it. I think you both had answers to that as we've gone through this, but just in the last few seconds I have over here, anything else you guys would like to add around that?
Well, like I said, there's two layers of protection. So from the publicly available information on the QR code, it's almost virtually impossible to reverse engineer to the PII or the identity of the person, because these are solutions that live on public blockchains, and they're hashed. There is no information, not even if you had their wallet information, it's pretty hard to trace it back to the owner of it without any more information being available. And that's how we separate out the public facing information from what's actually happening on the private level, right? And I think we can go more into the details of it, what happens on the front end, the server side of it, the infrastructural things that we've been putting in. But it's a pretty, we feel very confident that we've designed a very robust solution here.
Sure, and my answer is the same again, where we're trying to make sure everything, all the matching and everything happens on the phone, so that there's no case where any of this data is leaving the phone, and you can delete the app and all that will go away, if you want to. So yeah, that's kind of our way of protecting this kind of data.
Okay.
So
thank you, guys.
Thank you, Denzel. Are there any final comments that you personally want to make before we get into addressing some of the questions from the audience we haven't touched on yet?
Yeah, I think the last thing I'll add is, I really like seeing the comments that are coming in through the chat, because I think it's important to go through, these types of questions and, objections and discuss them, because, privacy is a right, in my opinion. And we have to figure out how we honor that. And, we're dealing with COVID, which is risky already. How do we protect people even further? Which, that's something I personally care about. So I really appreciate you two being open to having a discussion about it. Thank you.
Of course.
So I agree that in some sense, it feels like we've only given an introduction to this space and the issues. And it may be appropriate for HGA to sponsor a more in-depth discussion and webinar going more into the technical underpinnings of some of this. I know some of you in the audience could have great questions to ask at that level as well. But some of the things that have been brought up really are at a higher level than the technology. There are questions about, well, how reliable are the COVID tests? And we know that COVID testing positive and then testing negative may or may not incur immunity. And it isn't even entirely clear that people who have had the disease no longer can spread the disease. So basically, there's a lot of unknowns on the medical side of COVID, and they intersect with the assumptions that we make about the value of the technology. And I think that's an ongoing topic of discussion, and it's a good reason to be pretty conservative about trying to promote any single solution or aspect of a solution, as being the holy grail, because there clearly is not going to be one. Another question that's come in.
Can I add a little bit to that, Debbie? So on the testing side, I think the testing technology is not that robust. It's pretty well understood. Even if you go for a PCR test, it takes anywhere between 48 to 72 hours to get your results back, right? So how real time that's a big question mark, right? But I think given those limitations, you can still design a protocol around the testing where you're testing maybe 3 times a week to identify whether you might have been exposed earlier in the week or not, right? And keeping a track of that longitudinal information for at least a period of time. I'm not advocating forever, but maybe for at least 10 to 15 days until the onset of symptoms. Can you keep track of that record? And that starts giving you better and better understanding whether you might have contracted the disease. And also for false positives and negatives, I don't think I'm concerned about false positives, because if it's a false positive, your doctor will take care of yourself, right? you need to be going to your going through the isolation or working it out with your medical provider. It's the false negatives, right? And if it is a false negative, and these tests are only 30%, and the inaccuracy rate for the test is say 30%, a repeated testing regimen can really weed out those false negatives as well, right? So I think these things need to be understood with the statistical significance of how you put in these policies, as well as enabling what happens next with the appropriate technology.
Okay, there's lots of questions about passports creating different classes of citizens. So people who are young and healthy might be one class, people who are young and have had the disease might be another class, and then people who are in higher risk categories could be a kind of pariah class. It's not even clear whether having had the disease is a positive thing or a negative thing in this world. Do you have any comments on that, Aman?
No, I think we are blindsided by the actual technology that we have access to, and that's a fantastic question, but I don't think we'll know the answer to it for the foreseeable future. Is the virus mutating? If you had the first mutation of the virus, are you immune to second one? Are you immune to third one? Who knows what the future brings us? But again, that's why I feel very confident that one of these testing environments will scale pretty easily and be easy on the costs as well. And I'm aware of at least 2 of them that are vying for FDA approvals. And if one of those comes to the market, I think it'll be a pretty big game changer, where you can go out and test very cheaply, and you can get test results back within a minute, right? So that's significant progress. And if we have access to that kind of testing technology, then all of these questions are moot, because then you can only focus on where is the positive test result, and then then kind of just focus on the treatment and the care for those patients, rather than spending a lot of energy on people who are routinely testing negative.
Well, that's an interesting point of view that I'm not sure even I entirely agree with, but then again, I don't represent a large corporation, and I do think there are some significant challenges to being able to operate in the new normal, and there's a lot that is still going to unfold. One question that got asked was, what lessons have we learned from previous disease epidemics like AIDS and STDs? And having read some of the stories about that, they're pretty cautionary tales with respect to issues of trust. So in particular with AIDS, the city of San Francisco, which was where the disease first got recognized, had to spend a lot of energy building relationships with the community, so that when disease investigators called, people would actually talk to them and give them honest answers. And that's going to be a big challenge as we go forward, both for the public health authorities and for any of us who are trying to provide technology. That's one of the reasons why, in our case, we're doing Health Grid Alliance as a nonprofit, because we believe that without the hint of commercialization, we may be able to engage trust a little bit more readily. But I think this is a problem that we're all going to have to face and be sensitive to. In-depth contact tracing, which was what was done for AIDS, is a pretty human-intensive kind of skill, and really good contact tracing is not something that you learn in a week, despite the fact that 100,000 people are being supposedly contact tracing trained in the United States with these kinds of online courses. So I think there still remains questions about how this is all really going to unfold. Let's see. Do any of you see any questions that you really want to make sure we address? Denzel, Arka?
Hey, Hey, Debbie, I actually had one thing I wanted to add too. I think privacy is something that everyone should be their own advocate for, just like their own healthcare. I think everyone should be doing their homework and understand what they're comfortable and what they're not comfortable with too. And yeah, I think privacy is a very, very personal thing. I think us as practitioners of security and everything in the cloud, we're going to do our best to try and create solutions that protect people. But I do think people need to look at it, from their own personal perspective every time they look at solutions that are out there and just evaluate what is the risk to them.
So I think at this point, it might be interesting to just turn a little bit away from contact tracing by itself and talk about some of the other technologies that are starting to come into play here. So for example, Singapore is working on a piece of wearable technology because the adoption of their contact tracing app was not very high. And some companies like Amazon are starting to put in place, and Ford Motor Company, technologies that will help employees stay away from each other. Arka, what are some of the other things that you can envision maybe being good uses of technology in the near future?
Yeah, absolutely. So, like I said, in the spatial tech stack, there's so many location-based things we can do, which is not related to contact tracing. For example, if you wanted to enforce social distancing rules within a workforce, you can do that with the spatial technology in a factory, for example. I believe there was an article out where Ford partnered with Samsung watches, which was able to have a Bluetooth signature, same as the phone, and able to say, whether the employees are respecting social distancing. You could use the same technology to be able to direct medical supplies. For example, if somebody was to test, or at least even if somebody we know that somebody got exposed, we might be able to send them a care package specifically tailored to that person, right? And that could be it could be a care package, or it could be also be a medical supply within a hospital itself, and completely directed to the exact location of that patient in that hospital. So with spatial technology, you can really very accurately, in some cases up to the centimeter, be able to track goods within a hospital, for example, and then take them to the exact location without having to, whoever's delivering it. Could be even be a robot delivering the medical supplies to a hotspot or a sort of a danger zone. And finally, another thing you could do with spatial technologies as well, you could leave contextual data points, which is not even related to hotspots, or maybe related to how do you conduct yourself when you're inside a facility. Maybe some extra information about what you should and shouldn't do in a case of emergency. All that kind of data can be placed in the physical world around you, and there are multiple ways of reading that data, including the spatial browser that we have created, or it could be other apps that read that data and show it. So there's a lot of follow-on things you can build on top of this, and which will help opening up the economy and making it safer for the workforce to be back at work.
Great. At this point, we're close to the end of our time, so I'd like to give Aman and Denzel an opportunity for a few final words, and then we will thank everybody and adjourn.
No, thanks, Debbie, and it was wonderful to have been here. And just browsing through the comments, I think there's very, very interesting perspectives being put forward, all the range from the testing and the false positive, negatives, and believe me, we've tried to work through a lot of those scenarios, and I'm happy to engage with anybody who would like to. And I'll be making out. I can make my email available if people want to reach out. It's Aman, AMAN, at proteum.io, proteum.io. I'll put it on the chat as well. But thanks, Debbie, for having me here.
Great. Denzel?
Yeah, I'm on Orca, I think, and Debbie and team, thanks for pulling this together. I really love seeing, technology companies taking the time to talk about these things. I mean, let's face it, they're hard issues to discuss, they're hard issues to solve. And, the willingness and the openness to discuss these types of things and, come up with better solutions and understand, the fears that people have and the suggestions. Yeah, I think it's great that you guys are engaging people. So thank you very much.
Great. Orca, one last word?
Yeah, no, thanks guys for having us here. We're very excited to be able to work on this. And yeah, I really believe that spatial web could help with addressing these, this great challenge that we have, and potentially even further global challenges as well.
Great. Well, at this point, we will adjourn. Thank you all very much. And we look forward to engaging at the next level on this very important topic. And thanks to BCI.
Absolutely.
Thanks, everyone. Have a good night.
Thanks, guys.
Okay. Bye.